Hello everyone, my name is Anna and I'm going to be talking about the basics of Medicare 101. If you are an agent assisting someone with Medicare for the first time, or if you are someone who is barely going to turn 65 or barely new to Medicare, this video is for you. So these are important terms that you need to understand so that way you can either explain it to the person that you're helping with, or if you are new to Medicare, these are some vocabulary words to know. Deductible. Deductible is the amount paid out of pocket by the policyholder before an insurance provider will pay any expenses. So the deductible usually has to be paid before the insurance company starts covering their percentage. Coinsurance. Coinsurance is the percentage of the cost a covered health insurance pays. For example, 20%, 25%, 30%. After you have paid your deductible, the insurance company will pay their percentage and you will pay your percentage. Now, copayment. What is a copayment? A copayment or a copay is a flat fee that you pay on the spot each time you go to the doctor or fill a prescription. So for example, $10 copay to see a specialist, $15 to see a specialist, $5 copay for a certain medication. Premium is the amount you pay for all of your health insurance every month. So some plans have a premium, some plans don't have a premium. There's plans, depending where you live, that have a $0 premium. You don't pay for that plan. And then maximum out of pocket. Maximum out of pocket is the maximum amount that a person will pay for a whole year on covered healthcare services. It's like a cap. If you meet that limit, your health insurance plan will pay 100% of all the covered care services for the rest of the year. So for example, some plans have a $3,000 maximum out of pocket. That's the maximum that a person will pay for covered health insurance services. Once that person has reached the $3,000, let's say, then the company will pay for 100% of all the rest of the covered health services. So these are just important terms to know so that you can help somebody understand their plan. And so let's move on. Let's move on here. What is Medicare? So Medicare is the federal health insurance for anyone that is 65 and older, and for some people under 65 with certain disabilities or conditions. So usually for people that are going to be turning 65, they're going to be qualifying for Medicare. But some people who are disabled qualify for Medicare after 24 months of being disabled. Now, this is individual health insurance, and it is funded in part by federal payroll taxes that were paid while you were employed. So when we're employed, we're usually paying taxes towards Medicare, okay? Now, who is eligible for Medicare? To be eligible for Medicare, you have to be a U.S. citizen or legal resident. Legal residents must live in the U.S. for at least 5 years in a row, including the 5 years before applying for Medicare. And you must also meet one of the following requirements, which is either being 65 or older, or if you're younger than 65 with a qualifying disability. And people who are diagnosed with end-stage renal disease also qualify, or ALS disease. So there's a Part A and Part B for Medicare. Now, how do I qualify for Part A? Part A is usually at no cost for certain individuals. So for people who are 65 and older, to be entitled to the premium-free Part A, the individual or their spouse must have worked and paid Medicare taxes for at least 10 years, which is equal to the 40 quarters. And all individuals eligible for Medicare because of a disability, end-stage renal disease, or ALS are eligible for the premium-free Part A. But those individuals who do not qualify for the premium-free Part A, the costs for 2025 are as followed. $518 for individuals or their spouses who paid Medicare taxes less than 30 quarters. So somebody who is missing more than 10 quarters, they will have to pay for the Part A, which is going to be $518 in the year 2025. And those that paid Medicare taxes for 30 to 39 quarters, that means that they're missing less than 10 quarters, the premium for the Part A is $285. Individuals who are not eligible for the premium free Part A and those who don't buy Part A when they are first eligible may pay a late penalty fee of up to 10% unless they enroll during the special enrollment period. They will have to pay the higher premium for twice the number of years they could have had Part A, but they did not. So that's why it's very important to sign up for the Part A when you are first eligible to avoid those penalties. Now, what does the Part A cover? The Part A covers hospital insurance. So the Part A helps you cover for hospital and inpatient care, including hospital rooms and meals, care in special units such as intensive care, prescription drugs and medical supplies used at the hospital stay, lab tests, x-rays, and medical equipment as an inpatient, operating room and recovering room services, skilled nursing services, some blood transfusions, hospice care, including medications to manage symptoms and pain, part-time skilled care for the homebound after a qualified inpatient stay, rehabilitation services after a qualified inpatient stay. So this is what is covered by Part A from Medicare. But Medicare alone has its cost. So Medicare in 2025, beneficiaries pay the following amounts for inpatient hospital care covered under original Medicare. So there is a $1,676 deductible for each benefit period. That means that when a person is admitted to the hospital, they will have a deductible of $1,676. So that means that the benefit period begins the day an individual is admitted to a hospital or skilled nursing facility and ends when an individual has not received hospital or skilled nursing facility for 60 days in a row. Now, if that person is hospitalized for more than 60 days, they will also have a copayment per day of $419 per day. If that person is hospitalized for more than 90 days, the copayment will be $838 per day. This is just with Medicare alone, Part A. Now, how do I qualify for Part B? Okay, this is where you really need to know about the Part B. Some people qualify for Part A as soon as they're turning 65 and they have accumulated the 40 quarters, which is equal to the 10 years of paying Medicare taxes. But some people don't automatically qualify for Part B, especially if they continue their health care coverage through their employer. So it's very important that if you are helping someone who is new to Medicare, that you check if they are going to be automatically enrolled in the Part B, because sometimes they have to go to Social Security office and apply for the Part B. Now, to qualify for Part B, beneficiaries will have to pay a Part B premium. The premiums are based on income. If somebody is filing as individual, they will pay $185 a month if they make less than $106,000 a year. If it's a couple filing jointly, to qualify for $185 premium, which is the lowest premium, they have to be filing less than $212,000 a year. And here in this table, you can see some people will pay more for the Medicare Part B premium based on the way that they file their taxes. Now, these numbers are for the 2025, and depending on your area, most people will pay the $185 based on their income. That premium has to be paid, and the Part B deductible is projected to be $257, but I'll explain a little bit more about the deductible. Okay, now what does Part B medical insurance cover? Part B is gonna cover everything that's the medical. It's gonna cover things like the annual wellness visits, ambulance services, durable medical equipment, outpatient prescription drugs, such as drugs administered in the doctor's office, mental health services, inpatient care, outpatient care, partial hospitalization, intensive outpatient program services. So the Part B is going to cover basically the doctor's visits, the visits to the specialist, the preventive care, the outpatient care. So this is what's going to be covering all the medical, the Part B. Now, under original Medicare, just Medicare alone, if the Part B deductible applies, you must pay all of the costs until you meet the yearly Part B deductible. The deductible in 2025 is $257, and that amount has to be paid before Medicare begins to pay its share. The share that Medicare pays is 80%, and the share that you pay is 20%. Now, this is important for if you're an agent and you are explaining this to your client, or if you're brand new to Medicare. These are all the costs involved with just Medicare alone. You receive this card in the mail, you are getting Medicare for the first time, you're getting your Part A and you're getting your Part B, and you only keep this Medicare alone. These are all the costs that are going to be involved. There's going to be that Part A deductible for the hospital. You get admitted to the hospital, you will pay $1,676. Plus, there's the Part B premium of $185. If you make less than $106,000 a year as a single person, you will have to pay this premium every month. Plus, the Part B has a deductible of $257, which you have to pay before the Medicare covers the 80%, and you will be responsible for the 20%. So these are the costs involving Medicare alone. But there's options, and you as an agent, if you are helping your client, or you as a beneficiary of Medicare, you're brand new to Medicare, you want to understand your options. There's options so that you don't have to pay so much for having Medicare. There's options. One of the options is staying with your original Medicare, but you have to add a Part D. Part D is what covers the prescriptions. If you do not enroll in a prescription plan, there's penalties. So it's very important that you sign up for a Part D, which covers the prescriptions. So option A, you can stay just with your Medicare and sign up to your Part D. There's option 2, which you can sign up for a Medicare Advantage plan with a private insurance company. This is the Part C. The Medicare Advantage includes the same hospital and medical coverage as original Medicare, but it also offers the Part D, and it has extra benefits such as dental, eyeglasses, and wellness programs. So this is the Part C Medicare Advantage. And there's also the option of signing up for a Medigap or a Medicare supplement. So now let's see what the difference is between these options. Okay, so a Medicare supplement. A Medicare supplement helps pay some of the out-of-pocket costs not paid by Medicare, Part A and B. It's compatible with original Medicare, It cannot be used with a Medicare Advantage. This is very important. If you're an agent and you're helping someone, you need to make sure that if they have a Medicare supplement, they cannot enroll in a Medicare Advantage, or vice versa. If they have a Medicare Advantage plan, they cannot enroll in a Medicare supplement at the same time. Same thing for you if you are a beneficiary and you want to know if you can enroll in a Medicare Advantage at the same time as a supplement. You cannot. It's illegal. Now, a Medicare supplement includes 10 plans that are standardized by federal and state regulations, and the plans are designated by letters. For example, Plan A, Plan G, with coverage and costs that vary by every plan, and it is provided by the private insurance companies as well. For example, Cigna, Humana, United Healthcare, Aetna. Now, a Medicare supplement. So if you are turning age 65 and signing up for Part B, that triggers a 6-month Medicare supplement open enrollment period, when Medicare supplement must be issued regardless of any pre-existing conditions. So this is called the guaranteed issue right. A Medicare plan, Medigap, which is a Medicare supplement plan, cannot be used with a Medicare Advantage plan. So you know, this is why it's highlighted here in yellow. You got to be very careful to check if somebody has a Medigap Medicare supplement plan and they want to sign up for a Medicare Advantage. That Medigap plan has to be canceled first. It is illegal to sell Medigap plan to someone already in Medicare Advantage health plan at the same time. Now, a Medigap or Medicare supplement does not cover prescriptions. It does not cover regular dental, vision, or hearing checkups, eyeglasses, contact lenses, or hearing aids. It does not cover assistance with daily activities such as bathing, eating, or dressing, or long-term care needs. So someone who is signing up for a Medicare supplement Medigap must sign up for a prescription plan as well, and it does not cover any dental or vision benefits. Now, to sign up for the Medicare supplement open enrollment period, it lasts for 6 months beginning with the month in which you are 65 or older. So when somebody's just turning 65 and they are eligible for Part A and Part B, that triggers a 6-month enrollment period that begins the month that you turn 65 and are enrolled in Medicare Part B. There is no medical underwriting if you enroll during this time, which means they're not gonna check your pre-existing conditions. Your pre-existing conditions don't matter when you are just turning 65. You may apply at other times, but you could be denied coverage or charge a higher premium based on your health history. So that's why it's important, if you want to sign up for a Medigap Medicare supplement plan, that you do it when you are turning 65, though within those 6 months. Some states may have additional open enrollment rights under the state law. Now, these are some Medicare supplement insurance. Like I said, they are categorized by letters: Plan A, Plan B, D, G, and it goes all the way to letter F. Now, let's talk about the Medicare Advantage, the popular Medicare Advantage. If you are an agent assisting someone, this is the Part C. If you are a beneficiary who wants to sign up or wants to know more about Medicare Advantage, this is what Medicare Advantage plans cover. So this is another option to get your Medicare benefits. So alternative to original Medicare Part A and B, a Part C is going to be benefits administered by a health plan. It's going to include prescription drug coverage in most plans. Some plans do not have the prescription drug coverage. And the plans offer additional benefits such as dental, vision, fitness. Some plans include benefits for over-the-counter, healthy foods, utility bills. Now, all of the Medicare Advantage plans cover all of the benefits of Part A, except for hospice care, which is covered by Part A, and all of the benefits of Part B, most Medicare Advantage plans cover the prescription drugs. There are some plans that do not have prescription drug, so you have to be very careful looking at the plans. And those plans that don't have the prescription drug are usually for like veterans who already have prescriptions covered by the VA. Now, these are some facts of Medicare Advantage. So to be able to enroll in a Medicare Advantage, you must be enrolled in both Part A and B and live in the plan service area. You cannot enroll in a Medicare Advantage if you only have Part A or if you only have Part B. You must have Part A and Part B. You cannot be denied coverage based on your current financial or health status, including pre-existing conditions. So no plan can deny you being enrolled in that plan based on any pre-existing conditions. But you may be required to use provider and pharmacy networks. For example, out-of-network coverage is not available on HMO plans. So this is very important. If you are an agent, you need to make sure that you check your members' doctors and medications to make sure that they're covered by that plan. If you are an individual who is signing up to Medicare, same thing, you want to make sure that your doctors and your medications are covered by that plan. And the coverage and costs vary by plan and may change every year. So the plans do change every year. The medications formulary change every year. The doctors list, the provider list of doctors change every year. So that's why it's important to keep checking every year for any changes. So if you're an agent, it's important to follow up with your clients to see if the plan is going to affect them in any way, or if you are a beneficiary, it's important for you to check every year during open enrollment to see if there's any changes happening with your plan. Now, the good thing about Medicare Advantage is that it has an annual limit on out-of-pocket costs for covered services. So remember when we talked about the maximum out-of-pocket, these plans have a cap on how much money you will spend out of your pocket on covered services. Some plans have $3,000 maximum out-of-pocket, $7,000 maximum out-of-pocket. And some plans may charge a monthly plan premium. Depending on the area where you live, some plans do not have a monthly premium. Some plans are at zero cost. Now, there are different Medicare Advantage plans. Some plans are coordinated care plans. So some plans are HMOs, PPOs, special needs plans, or chronic special needs plans. So it's very important that you know the difference and that you know your client's needs. If you're an agent, that you determine if somebody is a chronic, somebody who's a chronic, that means somebody who has a chronic condition like diabetes or heart problems. Someone who is a dual, somebody who's a dual is somebody who has both Medicare and Medicaid. And also checking with your client to see if they would prefer a PPO plan. If you're a beneficiary, the same thing. There's different plans based on your needs. Now, what is the difference between an HMO and a PPO plan? So an HMO plan consists of a strict network of primary care providers, specialists, and hospitals. If a client attempts to see a provider who's outside of the HMO network, the client will be responsible for 100% of the cost. Now, with a PPO plan, a client who is enrolled in a PPO plan is not restricted to only using the providers in the network. But if the client wants to see a provider outside of the network, they will be responsible for higher costs. Not 100% of the cost, but they will pay just a higher percentage to see the doctor if that doctor is outside of the network. So that's why it's important to check, if you are an agent, that you check your client's doctors to make sure that they are covered by that plan, so that way they don't have to be paying all of the costs if they're in an HMO plan, or a higher percentage if they're in a PPO plan. Here with a PPO and an HMO, With an HMO, they are more restricted to stay within the network, and with a PPO, they have a little bit more freedom to see doctors that are outside of the network, but they're just gonna pay a higher cost. Okay, now there's different types of Medicare Advantage plans. There's the C-SNP. C-SNP, the C stands for chronic. This is a Medicare Advantage plan that is designed for clients with a chronic condition. To qualify, a client must have Medicare Part A and Part B, must live in the plan service area, and must have a qualifying chronic condition. Some examples of a chronic condition include, but are not limited to, diabetes, congestive heart failure, chronic obstructive pulmonary disorder. So you make sure that if you are an agent who is helping a client, to ask them questions about their health conditions. Do they have diabetes? Are they on diabetic medication? Are they on medications for the heart? This can help your client enroll in a plan that's gonna have more benefits and lower copays. If they do not have Medicaid, but they have a chronic condition. Now, if they do have Medicaid and Medicare Part A and Part B, and they live in the service area, they can qualify for a dual plan. That's what the D stands for, D-SNP. It's a Medicare Advantage plan for clients with both Medicare and Medicaid, and they must have Medicaid level such as QMB, MQMB, and there's other levels of Medicaid that we will talk about more in another video. But there's SLMB, there's QMB, there's MQMB, there's QMB plus, there's SLMB plus. So just making sure that you check if your client has Medicaid. How can you check if a client has Medicaid? By asking different questions, but that will be something that we can talk more about in another presentation about Medicaid and Medicare savings program. So you can help your clients who have Medicaid and Medicare, enrolling them in a D-SNP plan, which will have 0 copays and more benefits for dental, vision, hearing, over the counter. Now there's also the chronic D-SNP plan. This is for someone who has both Medicare and Medicaid, and they have Part A and Part B. They live in the service area, and they have a chronic qualifying condition, and they also have Medicaid. Now there's the Part D, which is the prescription drug plan. Medicare Part D insurance provides coverage for prescription medications and some vaccines. There's 2 ways to get prescription drug coverage. You can enroll in a standalone Part D plan through an insurance company, or you can get the Part B through a Medicare Advantage plan that includes prescription coverage. Now, to sign up for a Part D, you must be enrolled in Medicare Part A or Part B or both. So yes, if you have Part A only, you can sign up for Part D prescriptions. Or if you have Part B only, you can sign up for Part D prescription. Or if you have both Part A and Part B, you can sign up for Part D prescriptions. Now, when signing up for a Part D prescription plan, you may be required to use the pharmacy network. Each plan has different costs, and the plans vary and change each year. There is that Part D premium penalty for late enrollment unless you qualify for a special enrollment period. So if you are an agent assisting someone, it's very important that you tell them that there is a late enrollment penalty if they don't sign up for the Part D prescription. Now, this is what the late enrollment penalty is in 2025. That is added to your Part D premium. The penalty is going to start at any time after your initial enrollment period. There is a period of 63 or more days in a row when you don't have Part D or credible prescription drug coverage. Now, if you sign up for extra help, if you're an agent and you find someone who did not enroll in the Part D and they're paying a late enrollment penalty, You can check if they qualify for extra help. And if they qualify for extra help or Medicaid, they won't pay that late enrollment penalty. But like I said, I'm going to talk more about Medicaid, extra help, and Medicare Savings Program in another video. But if you encounter someone who has extra help, they will not have to pay that late enrollment penalty. Now this year, the late enrollment penalty is calculated by multiplying 1% of the national base beneficiary premium, which is $36.78, times the number of full uncovered months that the person was eligible but didn't join a Medicare drug plan and went without other credible prescription drug coverage. The final amount is rounded to the nearest 10 cents and added to the monthly premium. So this is the way you calculate it. You multiply $36.78 times 1% times the months without coverage, and then you round it to the nearest 10 cents. So if someone qualified for Part A or B, or both A and B, and did not sign up for the Part B when they were first eligible to sign up, and if they were without the prescription coverage for a period of 63 or more days, then the clock starts ticking, and this is the way that you can do the calculation. But like I said, if you're an agent and you encounter someone who has that penalty that they are going to have to pay for life, you might be able to save them from that payment by doing a simple and easy extra help application for them. And I will be sharing that extra help application link here in this presentation, and as well as in the other video where I'm going to be talking more about the extra help and the Medicaid. So very important if you're an agent, and if you are an individual and you are wondering, do I have to sign up for Part D? Yes, there's penalties if you don't. Okay, so now the Part D. What do the Part D prescription drug plans cover in 2025? This is for 2025. Last year it was different. This year it changed. So every plan has an annual deductible, or not every plan. Some plans have an annual deductible. If a plan has an annual deductible, you have to pay 100% of the prescription cost until you hit the deductible amount, which is going to be $590. That's the highest in 2025. Once you have met that annual deductible, you are in the initial coverage. So after you've met the deductible, you'll just pay 25% of your prescription cost. This phase lasts until your out-of-pocket cost reach $2,000. So once you have reached $2,000 in prescription medication, you are going to reach the catastrophic stage. So once you hit that $2,000 mark, you won't have to pay anything more for your medications for the rest of the year. So this is an example right here. Mr. Garcia is enrolled in STAR Medicare Advantage plan. This plan has a deductible of $350 for medications that fall in tiers 3, 4, and 5. So tiers 3, 4, and 5 are medications that are at a higher level. He's taking 2 different medications. His first medication is a tier 1, which has a $0 copay, but the second medication falls into the tier 3 category, which has a $45 copay, after he has met the deductible of $350. So because this plan has a deductible of $350 for medications that are levels 3, 4, and 5, and he does have a medication that's a tier 3, he will have to pay the $350 plus the $45. So he went to the pharmacy, and for the tier 1 medication, he didn't pay anything. However, for the tier 3 medication, he had to pay the $395, which is the deductible of $350 plus the $45 for the first time, for the deductible of $350, and then the copayment for the medication. The next month, when he goes to the pharmacy again, he's only going to pay a $45 for that medication because he had already met the deductible. So here in this example, you can see, okay, so here, even though the client only paid a $350 deductible, CMS will count the full deductible of $590 plus the copay of 25% of the full medication, whichever one is greater towards his troop. In this case, the client will have paid $395 his first month, but a total of $751.25 was counted towards his troop. Each following month, the client will have a $45 copay, but will have $165.25 credit towards his troop. Once he reaches $2,000, the client will fall into the catastrophic phase and pay zero for the remainder of the year. One important thing, if you are an agent, you can enter your client's medications in the RX calculator, depending what company you are quoting with, and it will tell you exactly how much the client will pay for the medication, if there's a deductible, how much they will pay each month. If you are a beneficiary who is confused about all these numbers, it's important that you find an agent who can help you, quote all your medications. That way you can be in a plan that will cover your medications and you will have to pay less for them. So it's very important to know about the extra help and the levels of the medications. Okay, so here's an example. Here's the Part D breakdown for this client. The first time around, he had to pay a deductible of $350 plus the copayment for that medication. And then after that, every month he only pays the $45 for that medication. Okay, by September, he reached the catastrophic phase. He already reached the $2,000, so after that, he doesn't have to pay anything for the medications. Okay, he only had to pay $755 that year. But if you can see here what the company, the manufacturer, paid every month for that medication. So the company paid a total of $6,985. And this is when the client reached the $2,000 mark by September. Now let's talk about the enrollment periods. When somebody can sign up for a Medicare plan, if you're an agent, it's very important that you know when you can enroll your clients into a Medicare plan. So the annual enrollment period is from October 15th through December 7th each year. This is a time of the year where you can enroll in, change, or cancel a Medicare Advantage plan or a Medicare Part D prescription plan. You can also switch from original Medicare to a Medicare Advantage or vice versa. If you have a Medicare Advantage, you can drop it and go back to Medicare, original Medicare. You can also transfer from one Medicare Advantage plan to another. So this is the time of the year where you can make changes, and the coverage begins on January 1st. So any changes that you do during the AEP period, October 15th through December 7th, those changes will not become effective until January 1st. That's that exciting time of the year where there's a lot of changes going on. Now we also have the Medicare Advantage Open Enrollment Period, which is OEP. This is exclusively for Medicare Advantage Plan members. This is the time that a Medicare Advantage Plan member can switch from one Medicare Advantage plan to another, or they can go from a Medicare Advantage plan to original Medicare. This is also the time that they can enroll in a Part D prescription plan if they're switching back to original Medicare. And it's only one coverage change permitted, so they can only make one change during this time. And this time is from January 1st through March 31st every year. And the plan becomes effective the first year of the following month after you sign up. So if somebody makes a change in January, the plan will become effective February the 1st. If somebody makes a change in February, the change will become effective March 1st. And this is a time where you can enroll in a Medicare if you didn't do it during your initial enrollment period. Okay. So if you did not sign up for Medicare Part B, this is also the time you can apply for Part B Medicare. Now we also have the initial enrollment period. The initial enrollment period is for anyone who is turning 65. You can start helping them out 3 months before the month of their birthday, the month of their birthday, and 3 months after. Okay, and it's important that you start helping those people as early as you can so that they don't have to pay those penalties and to avoid gaps in coverage. Okay, so you can do it if their birthday is in May. You can help them enroll in May or in April or in March or in February, not before that. Or you can also help them during that month of May, June, July, or August. This is for somebody who is new to Medicare turning 65. Now there's also the special enrollment periods for qualifying life events. So this happens, you can enroll people into Medicare plans other than AEP, OEP, or the initial period for certain reasons. So this is typically following a qualifying event. You have a window of two full months starting from the month after the event to adjust your Medicare Advantage or prescription drug plan. Within this period, you can enroll in, switch, or discontinue a plan without incurring any penalties, even outside of the regular Medicare annual enrollment period. So any qualifying events include moving from one service area to another, leaving retiree, union, or COBRA coverage, chronic condition, and more. So a chronic condition, somebody who is has a chronic condition such as diabetes or a heart problem, they can sign up into a chronic plan outside of the AEP, annual enrollment period, and outside of the OEP, open enrollment period. And there's other events where you can help somebody enroll if, for example, they lost Medicaid, or if they're gaining Medicaid, or if their Medicaid level changed as well. Now, for those that have Medicaid or LIS, before we were able to enroll them or change their plan throughout the year, but that has changed. Clients with these levels can only make one change, which is during AEP, during OEP, but they're not going to be able to make any more changes throughout the year from April through September. Okay, the only opportunity that they can have to make a change is following the following rules. Somebody who has full Medicaid can make a change if they have a plan that's aligned with their Medicaid. Okay, so this is the example. So from April through September, when it's special enrollment period, when it's not AEP or OEP, somebody who has Medicaid can only make a change if they make a change to their Medicaid plan, but it has to be aligned. So for example, somebody who has Molina can change to a Molina plan only if it's going to be aligned to their Molina Medicaid. And here there's an example with United Healthcare, because this year these are the companies that in our service area that allow those changes to be aligned with their Medicaid. Okay, so I know it was a lot of information. If you are a Medicare recipient, if you're going to be new to Medicare and you have questions, my contact information will be shared in the bottom. If you are an agent and you have questions, the same thing, don't hesitate to reach out to me. I know it can be a lot of information and confusing, but you don't have to do this alone. If you are an agent, it's very important that you review your Medicare 101, especially for your new to Medicare clients, that you explain all of the costs and their options, and that you check everything, all their needs, their doctors or medications, so that you can offer the best option for them. I will be sharing another video on Medicaid and explaining everything about the Medicaid levels, but this is going to be in another video coming soon.